When your pet is unwell, they may need diagnostic investigations, surgery, or other procedures to find out what is causing their symptoms and to provide treatment. Most tests and procedures need to be performed when the patient is unconscious, so they don't move or feel pain. To achieve this, patients are given a general anaesthetic. Before your pet has their general anaesthetic, it is important that their stomach is as empty as possible. This reduces the chances of them inhaling some of their stomach contents. In general, pets can be given their evening meal as usual, but must not have breakfast on the day of their procedure. This advice may be different for some patients, for example, in very young animals, very small animals, or those with diabetes. Your pet can drink water whenever they like during the day of their hospital visit. If your pet routinely takes medication, please let your vet know. They'll advise you whether to give this as normal before the procedure or not. Our specialist team of veterinary anaesthetists and anaesthesia nurses follow a thorough process to ensure all patients are kept as safe as possible. This process begins by reviewing the patient's medical history and performing a pre-anaesthetic examination, which may include blood tests. The anaesthetist then creates an anaesthetic plan, which is tailored to your pet's needs. This plan takes into consideration factors like your pet's size, age, breed, the reason for the general anaesthetic, and if they have any pre-existing medical conditions. Safety is a key component of anaesthesia. Having a tailored anaesthetic plan, combined with constant monitoring by our specialist anaesthesia team, helps to reduce the associated risks whilst providing adequate pain relief. To prepare your pet for their procedure, a small patch is shaved on their leg, and an intravenous, known as an IV, catheter is placed. This catheter allows the vets and nurses to administer medications and fluids. Your pet is first given a pre-medication. This helps to relax them, provides pain relief, and reduces the dose of anaesthetic drugs required for their procedure. The next stage in the process is called induction. This is when the general anaesthetic drug is administered. The anaesthetic takes effect very quickly, and your pet will become unconscious within a minute or so. Then your pet is what we call intubated. This is when we place an endotracheal tube within the windpipe. This tube allows anaesthetic gas and oxygen to be continuously administered to the patient, therefore keeping them in a state of unconsciousness throughout their procedure. Your pet is then prepared for their procedure, which may include their fur being clipped. Some patients will require additional measures, for example medication which numbs the affected area, called a nerve block. These medications are given shortly before their procedure. During the procedure, our anaesthesia nurse uses a multi-parameter monitor to keep a close eye on your pet's vital signs. These include their heart rate and rhythm, blood pressure, blood oxygen levels, carbon dioxide levels, and body temperature. A ventilator may be used during the procedure to provide support for those patients who are unable to breathe on their own. Once the procedure is finished, the anaesthetic gas and oxygen are turned off. The endotracheal tube is carefully removed, and our anaesthesia nurse continues to monitor the patient's vital signs as they wake up. Patients lose some of their body temperature during a general anaesthetic, so they're kept warm with hot air mattresses and blankets, both during the procedure and whilst they recover. Recovery is a critical time, and so our nursing team continues to monitor the patient once they're back in their pen. Some patients return home the same day after a general anaesthetic. They may be sleepy and seem a little out of sorts. Their appetite, behaviour and toileting habits may also appear to be different to normal. This is common and will pass in a couple of days. To help your pet's recovery at home, keep them in a quiet room and use blankets to provide warmth and comfort. Your pet may experience a little vomiting or diarrhea and may have a slight cough after their procedure. If these symptoms continue past a few days, or if you spot any other cause for concern, please contact your vet.